Welcome to the new talk show, Health Matters, with your lovely host, Ugonano CK. On this show, we will be interviewing doctors, pharmacists, nurse practitioners, dietitians, and many other health professionals. Thanks for watching. Hello, and welcome back to Health Matters. Last show, we talked about diabetes. We talked about the symptoms of diabetes and what diabetes is. This show, we're going to continue with management of diabetes. I want to introduce to you our Dr. Linda Uhegwu, our beautiful, radiant, able and ready Dr. Linda Uhegwu, with all of our information. So, we're going to discuss management. Should we start? We already remember what we discussed last time, so let's start with our management. So how can we manage diabetes once you get diagnosed?
Well, definitely. Let's jump right in and let's get to the root of what we need to do. Well, what do you do when you are told you have diabetes? First and foremost, you have to now accept the truth. You can no longer be in denial, okay? You have been in denial that something is happening. In denial that you don't feel well. Now it is time to accept the truth, because that is the only time that you can truly accept help. And your doctor will always put a plan together in order to make sure that you have exactly what you need to fight diabetes, keep it controlled, and to live a healthy life. And this is where health matters. So, management. When someone comes to my hospital, my biggest thing is, how do I make sure they understand what this is a family affair, need to do? And it's not just one person. It's not just you alone. It's going to be your family. It's going to be your family support. It's going to be your friends. It's going to be your doctors. We are all on board. The first target is your sugar target. We're going to give you the range of where your sugar should be. So keeping that in mind, you're going to be testing your sugar more often than you ever have, because you've never had to test your sugar. And we're going to give you the range and say, we need you to keep your sugar from this point to this point. And then we're going to ask you to write it down. If you check your sugar 3 times a day, you should have 3 logs into your journal. And when you come back to see your doctor, guess what that journal is going to do for us? It's going to help us understand what your body is doing. We can manage you based on what you provide us. The information is very vital. It's all important for your health. The next thing will be physical activity. Sometimes when we talk about type 2 diabetes, usually the type of diabetes that occurs with adults, we think that someone has to be very obese, not eat healthy, and they need to lose a lot of weight. Well, unfortunately, that's not always the case. Remember I mentioned that sometimes you can be overweight, you can be obese, and your pancreas burns out. It's like, man, I'm tired of producing all this insulin for all this sugar. Well, sometimes your body can still tire out, even if you don't have all that excess weight. I've seen a lot of people who are not obese, who are not overweight, they eat well, and unfortunately, they still develop diabetes. Even in that scenario, there are medications that can be used, continue with physical activity, because what people don't understand is that the physical activity, walking and running, keeping your cardio up and keeping your heart rate and beating very well, can open up the cells enough to get sugar inside. And that's where physical activity comes in. Now, will it always work? Will it open up enough cells in order to take all of the sugar? Maybe not. But it can help to some degree where you may not have to take as much medication. So it's still helpful. So one of the other ways of helping is to really understand, what are you eating? Now, in my hospital, we usually work with nutritionalists and dietitians who help our patients make sure that they understand on a daily basis what they are eating, how it's affecting them, how it can affect their diabetes, what they can change. It's very important. And we need to take certain measures in order to understand what we put into our bodies affects us. And we need to know how best to manage when we're not in front of our doctor. How often do you see your doctor?
Ooh, maybe like once a year.
Okay. Well, if you see your doctor once a year, let's say you end up with diabetes, you may end up seeing your doctor maybe 2 to 3 times a year. Even during those clinic visits, you are going to get a scope of what that doctor knows. The management, everything else that you do is up to you.
Oh, wow. Okay.
So you, at some point, you become the person that is managing your diabetes, and you need to take control of it, and you can do that. You can really do it. And I just want to encourage you that as a doctor, we stand with our patients, and we make sure that they understand we're with them. Call the office, come by, we'll continue to work with you. But always understand, day by day, week by week, you are the one that is managing you, and you need to take control over that. So what you eat and how you eat it, what you put into your system is always going to be important and always needs to be thought about. The next part that helps to manage your sugar levels is actually limiting the amount of alcohol you take.
Oh, really?
Yeah. Alcohol tends to have quite a bit of sugar in it, carbohydrate.
Really? So, sorry, what about wine? The difference between wine, champagne, beer?
Well, so what I mean by limiting your alcohol is everything in moderation. So if you drink a bottle of wine a day, that may be a bit too much.
That's a lot.
Yeah.
A whole bottle?
Well, if people can. So if you are drinking to that degree, bringing it down a notch, bringing it down and simplifying it, not drinking as much, will actually help the amount of sugar that's in your system. So limiting alcohol doesn't matter which specific alcohol, but it matters the quantity, how much you're drinking, and how often you're drinking it. If you drink once a year during Christmas and you drink a glass, that doesn't affect you as much. Versus drinking every day and you're drinking a 6-pack of beer, that will affect you. So keeping that in mind, really try to help yourself by decreasing the amount that you're actually drinking. So when we talk about management, we talk about physical activity, the foods that you eat, you're talking about your targets of the sugar levels, checking your sugars. Those are all management tools. But you have to understand that when someone comes to our clinic, you may be anywhere from age 3 years of age to 80 years of age. And we need to manage you appropriately. Whether you're young or old or even in between, there are things that we do to make sure that you are on the right plan. So like I said before, not everybody's plan is the same. So we need to really understand how the age affects the insulin, how the age affects your sugar levels, because as a teenager or as a young adult, you may be very active. And you may have episodes where you're not eating as much.
True.
Or you go long periods of time and you don't eat. That can be harmful depending on what kind of medications you're on. So you have to keep that in mind. So age is a big determination that we like to...
For the type of medication that you're prescribed?
Medication, even the lifestyle.
Okay.
So we keep the age in mind. We keep your weight in mind.
Okay.
Sometimes when, like I said, people are overweight, we determine if you lose a certain percentage of your weight, 5 to 10%, you're at higher likelihood of managing your diabetes a lot more.
Okay.
And so we keep that in mind too. And we also keep in mind if you have any other medical problems.
Any other medical problems?
Now, if you have any kidney problems, heart disease, or liver conditions, that can actually affect the production of your sugar, the storage of your sugar. So these are the things that we have to keep in mind as we're helping to devise a plan. So it's not just a simple fix. It's a very thought out, extensive process that when we do it, we're really trying to put it into a plan that you can follow and that is appropriate for you.
So what are some medications that you should be familiar with if you're diagnosed with diabetes?
Well, there are several medications, and you know, they're actually changing, and some of them are actually new as of the past couple of years, which is not going to be as important to talk about. But some of the main things that you should know is that there is a form of insulin that is made, and you can use this insulin. Well, is it what we call the short-acting insulin or the long-acting insulin?
Short-acting and long-acting. Is that what you said? Okay.
Yes. And the reason I say short-acting or long-acting is because it does make a difference. If you're going to eat a quick snack or a meal, you're going to use insulin because you want that sugar to go into your cells immediately.
So you take your insulin before you eat that snack or that meal.
Exactly.
Okay.
And it's called short-acting because it works really quickly. But you have to make sure that you're eating. If you don't eat, it's going to bring all the sugar into your cells and you're going to get a low sugar.
So you said if you don't eat, it will bring all the sugar into your cells?
It still has the key and it still unlocks the cell.
Okay, the insulin that you've taken.
And the insulin that you've taken. So the insulin will still bring the sugar into the cells, but you may not have enough sugar for the body. And so that's why eating is important, and that's where age comes in. Because age is a big player on how much you're eating, when you're eating, how you're eating. So definitely we have to keep that in mind. So one of the medications that everyone kind of knows about is insulin.
Yeah.
But there are forms of insulin, the short-acting, the long-acting, even the in-between acting. And that is just determined on how much insulin you need, how much control you need, and depending on how high your sugars really are. We will devise a plan and say, you need to be on insulin, and this is the time. We teach everyone how to take insulin. We teach everyone how to check their sugars, and we teach you what to look out for when you're taking insulin, because it can bring your sugar from very high to very low, and there are things that you should always watch out for with that. The other medication that is very common, and what's very good about the medication is that the cost of it is pretty low.
Okay.
So it's very affordable. And we call that particular medication metformin, and it's a pill.
I've heard of that pill.
Yeah, so it's a pill, and it doesn't really work on insulin. But this medication helps to store sugar. So it really still helps with your storage, and it's great. But the problem about it is that
You still have to take insulin with it?
not always.
Okay.
But the problem with that, with the medication, is that one of the side effects is that it can upset your stomach.
Oh, okay.
It can cause nausea, it can cause diarrhea, it can cause you to have,
Even if you eat?
even if you eat. So most times I've realized that these symptoms last maybe 5 to 7 days and then they're gone. But sometimes people can't tolerate it because the symptoms don't go away. And then you go to other medications, but metformin has been one of the most common medications that we've used for diabetes. And that's just to name a couple of medications that you will know about. There are other medications, and they work in different ways. If we discuss them now, I think they may be getting a little bit over a lot of people's scope of understanding.
Okay.
But what I would say is, if you're diagnosed or if you have a concern, always talk to your doctor so they can bring you into a very good testing and a very good plan. Even if you're at risk and have prediabetes, there's always a plan that you should follow. Now, because we talked about medications, and I told you that sometimes, like if you're taking insulin, you can go from very high to very low. There are warning signs that you should always be aware of.
Okay.
And because these are the danger zones, sometimes the doctor may say, I'd rather your sugar be high than be low. Because what it tells us is that when your sugar is low, it stresses the body to a very high level, meaning it stresses the kidneys, it stresses the heart, it stresses the body. So we don't like low sugars. We like normal sugars. We don't like low sugars. And low sugars are anywhere from a sugar level of 40, 30, 60. Those are low sugars. Those are what we don't like, okay?
But they prefer, you said doctors would prefer sometimes a high sugar?
Well, if we know that your sugars are going too low,
Okay.
we would prefer you on a higher
And
end
why?
of normal.
Okay.
Of normal now. Now, we don't want you too high.
Okay.
But of the higher end of normal to protect you from the dip. Because some people are just very prone to dipping.
And to protect your organs from overworking.
There you go. So one of the warning signs is that when your sugar can be too low, you may become very anxious. Very anxious, you don't know what, you just have a funny feeling and it's just funny and you just can't, you're restless, you're all over the place and you're really not able to put things together of why you feel like that. And I discussed last time that I know my normal, you know your normal. We've been doing it for years. When it's not normal, it's not normal. And you should get it checked out. Those are important things.
So trust your body.
Trust your body will always keep you aware of what's happening. One of the other things is confused. You could be very confused. And these are the things that, you know, you're sitting here having a conversation and then all of a sudden you forget everything that you were talking about or doing. That can happen with age, or it could actually happen out of the blue. With a new diagnosis of diabetes, if you start to see some of these signs, I would get it checked out just to make sure that everything is okay.
Okay. Wow. Linda, you're so smart. Well, thank you. I really appreciate all the information you gave us today. So last episode we learned about the symptoms. Today we learned about management.
% of all cases in the population. It's most common in the over 40 age group in the white population and in the over 25 age group in the black or South Asian population. Type 2 diabetes is a little more complex because of slightly more processes at work. Either the body isn't producing quite enough insulin, or the insulin it is producing isn't working properly. That can be due to being overweight because a build-up of fat can stop insulin doing its job properly, but it can also happen in people of a healthy weight. So in type 2 diabetes, the carbohydrate containing food is broken down into glucose in the stomach and digestive system as normal. That glucose then moves into the bloodstream. The pancreas starts to produce insulin, which moves with the glucose through the bloodstream to all the body cells which need glucose for energy. However, the glucose can't always get into the cells because the locks to the cell doors have become furred up with fat deposits. That means that the insulin can't open the cell doors properly. So the level of glucose in the blood continues to rise. In response to this, the pancreas produces even more insulin. So the blood glucose levels continue to rise and the insulin levels continue to rise. This situation is further complicated by the cells, who are desperate for energy, sending out emergency signals to the liver to release stored glucose. The blood glucose level goes up and the pancreas produces more and more insulin until it can't cope anymore and eventually it wears out. As with type 1 diabetes, the symptoms of type 2 diabetes are going to the toilet a lot, thirst, thrush or genital itching, slow healing of wounds, blurred vision, tiredness and weight loss in some people. The symptoms for type 2 diabetes come along very slowly and some people don't have any symptoms at all. So for that reason, people can live with type 2 diabetes for up to 10 years before they realise that they have it. Type 2 diabetes can be treated in a number of different ways. Initially, it may be sufficient to make changes to the food you're eating and to take extra physical activity or lose any weight that may be appropriate. But type 2 diabetes is a progressive condition and most people will need some form of medication to treat it.
Welcome back. Oh my goodness, I got carried away. But we're still here with Dr. Linda Uhebu, and we will continue to discuss our topics. So we were talking about the warning signs in management.
Oh yes. So just to really kind of go through them really quickly, I talked about confusion, being confused if you're taking medication, especially insulin, having a funny feeling, restlessness, and one of the other signs, like mention of the diagnosis of diabetes, is the blurry vision.
Yeah.
So that comes right back in saying if you have a complication with the medication, maybe blurry vision as well. One of the other things that can be potential is like tingling of your hands or your feet. Those are potential warning signs of the medication and having an effect of something.
Okay.
Not always, but they're potential. So that's just something to keep in mind. If you're newly diagnosed with diabetes and you're on new medication and you don't really know what's going on, talk to your doctor and they'll be able to help guide you to find a good answer of what's happening.
Okay. Good. So what about complications?
Oh wow, yeah. So in diabetes, we stress very much. You have to control your sugar levels. And no one really takes us serious. I don't know why. Maybe we're not saying it with enough strength, but it's very important. If you don't protect your sugar levels, those high sugars are going to affect your organs. And I'm not just saying, your skin may change and, be dry. What I'm saying is it can cause you to have heart disease. It can cause you to have an increased risk of heart attacks. It can cause you to have an increased risk of a stroke. It can cause kidney failure, even to the point of being on dialysis. It can literally cause your nerves to get damaged. So you don't have feeling or sensation in the tips of your fingers or even your feet. Like, not controlling your sugar levels can infiltrate in any organ, and they can cause serious harm to those organs. And that's just to name a few. But those are some of the most serious complications that we see. Even when we see someone who's had diabetes that's been untreated for a long time, they may have had the blurry vision like we talked about, and they may have had it for a very long time, not paid any attention to it. They may have compensated for it, and guess what? The damage that is done is not reversible. So we can treat to stabilize them where they are, but sometimes because people are in such denial that something is wrong, we can't reverse what's happening. And our goal is to protect you. We want you as a person to have a full life. So the best way to have a full life is to respect yourself enough to tell yourself the truth. And if the truth is something is wrong, then something is wrong. And we don't judge, and we're not here to judge, because I have family members that I have to talk to, and it's hard for me as well. But I want to be very open, I want to be very honest, and I want to be forthcoming with information, so when they leave my presence, they're well informed, they have what they need, and they can try to start living a better life for themselves, so they can continue to be married, watch their children, their grandchildren, and live a good life. That's what I want for my family. So that's what I want for the Health Matters family. I want everyone to have that opportunity. And so just like I want the opportunity for myself, I want to provide the opportunity for you to be able to take control of your health. And this is one of the ways to do it. So when I know complications can occur, my first goal is to diagnose you. My second goal is to put together a very good plan. And within that plan, I'm going to look for different ways of making sure that your organs are protected. And if they're not protected, we may talk about other medications to protect them, but we'll discuss that when we have your chart and your blood samples and everything together. And we can put a plan together for you. And that's the goal. It's a serious condition that can affect that it doesn't just affect, but it can really hurt a lot of people. And And so if we can do something about it in any way, I'm willing. And so I'm here, and I'm willing to do it for anyone who has an issue. But we have to be willing to step forward. I can't go and find you.
Exactly. You have to know your body,
Exactly.
know when you're not in your normal, and be able to go to your doctor.
Absolutely. And we'll be here, and we'll work with you, no matter what it takes.
But diet is number one. Diet and lifestyle. Exercise.
Absolutely.
I think a lot of people in this country, maybe around the world, are addicted to sugar. I think that happens a lot.
Well, I think we use sugar more and more now. And I think what has been happening and what we're seeing as an epidemic is the younger children are becoming more obese. So their body is overworking at such a young age, at the very beginning of their livelihood.
Yeah.
So by the time they become a young adult, they're seeing me for the first time with serious complications. So those serious complications sometimes, unfortunately, can be very traumatic. One of my patients, a young guy, ended up with a heart attack. And you're not even 30 years of age. That's a big deal. And it's because of a hard lifestyle of denying what is wrong with you, not seeking help, and over time, you lose. We can help, but there's no sense in losing what can be helped. So, yes, can diabetes be prevented? Yes. But it also starts from very, very stubborn mothers who won't let you have McDonald's and candies, but you know, they tried. And they tried for a generation that they knew.
Yes.
And they tried for an era that they knew. So you and I are going to be the new mothers. So we need to start implementing these things into teaching young children around us, young siblings, young cousins, church members, how to eat better than what we're doing.
Yes.
And so I think it's a family affair, it's a village to raise one child. It really takes a community to raise a community. And if we start with the people in our own community, then I think we'll be doing ourselves some justice.
So no fast food, more home cooked meals, and not too much fufu at home either, because that turns into sugar and rice.
There are definitely a lot of things to be in moderation.
Good. Thank you, Linda.
Very welcome. I'm so happy to be a part of your team.
Isn't she beautiful? She's beautiful and smart. Lovely combination. Who's the lucky guy? Okay.
Well, we'll have
You don't have to tell us
next time.
that this time. But anyway, we thank you again for joining us, informing us. We'll have you back for new topics, new health topics. We thank you guys for being with us, listening and learning. This is Health Matters. I'm your host, Ugonna CK. Join us next time. We'll see you